What I'm about to tell you happened with a real patient in my office a few years ago, and believe me, the title is not clickbait. In fact, a dental consultation saved our patient's life. Let's take a look. The patient came to our office for a routine checkup and cleaning. We make sure to perform a checkup not only of the teeth, but also of the oral tissues. In our patient's case, we found a swelling under her tongue, which we immediately sent to the oral pathologist for evaluation. It turned out to be oral cancer, and fortunately, we caught it in time. A few more months, and perhaps the prognosis would not have been favorable. The problem is that the patient never knew that what she was feeling could cause her problems. So that's why today I'm going to talk to you a bit about mouth lesions that can be dangerous. It's better to know about them than to let them go unnoticed. Oral cancer or mouth cancer is a malignant tumor that can occur in the lips, gums, tongue, floor of the mouth, maxillary or mandibular bone, inner cheeks, and palate. It's one of the diseases with the highest mortality rates worldwide, as the overall survival rate for patients with oral malignant processes is 50%. 3% of annual deaths worldwide are caused by oral cancer, 2% in men and 1% in women. So let's see what the main causes of this disease are. Smoking. Oral cancer increases significantly in societies where it's common to start this habit at an early age and continue into adulthood. It's caused by tobacco in its various forms, for example, cigarettes, cigars, tobacco pipes, and chewing tobacco, among others. Radiation. People who, for work or leisure, are exposed to sunlight or tanning beds without proper protection, for example on the lips, are prone to developing squamous cell carcinoma, usually of the lower lip. Now let's look at other mechanical causes. When we have prolonged friction or irritation in the soft tissues of the mouth, whether caused by rough teeth, dentures, or ill-fitting bridges, and they're not properly attended to, a cellular mutation can occur, causing oral cancer. Infections. An alarming increase in oral cancer has been seen in young, non-smoking populations, caused by different viruses such as human papillomavirus and HIV or AIDS, among others. Now, other important factors that can also cause oral cancer are poor oral hygiene, medications that immunosuppress the patient, nutritional deficiencies, alcoholism, having had some type of head and neck cancer, and pre-existing oral diseases. That's why it's vital not to combine these factors to reduce the chances of having this disease. For example, smoking and drinking alcohol. Now, what are the symptoms? Pay attention here. I don't want to alarm anyone. In fact, it's most likely that you don't have cancer if you have any of these symptoms, but it's very important that you know them so you can visit your dentist if you suspect anything. This disease can start with sores or canker sores, which in the early stage are not very bothersome or even painless. The pain can increase as the tumor progresses. The key here is that these sores or lesions, once they appear, they don't go away. So if your mouth lesion lasts less than 15 days, it's most likely something viral and temporary. These sores change shape into mouth ulcers and they usually bleed. Other symptoms can be, for example, pain when swallowing saliva or chewing, bad breath, loose teeth, paresthesia or numbness of the affected area, red spots or white spots in the affected area, a lump that from barely being noticed starts increasing rapidly in size, unexplained bleeding in the mouth. Pay attention here, because although it doesn't mean that if your mouth bleeds you have cancer, there shouldn't be blood in the mouth of a healthy patient, so if your mouth bleeds, you should go get checked out. Now, there are factors you can detect in your mouth that aren't necessarily cancer. For example, lumps under the tongue caused by a clogged salivary gland, which isn't malignant, but you should have it treated. Another, for example, is the formation of bone under the tongue, called mandibular torus, which shouldn't alarm or worry you either. Now we're gonna talk about the treatment of oral cancer. Normally, the dentist is trained to detect an oral cancerous lesion during a routine checkup visit, and at the slightest suspicion, will recommend the patient see a pathologist to perform tests that lead us to a more precise diagnosis. If the diagnosis is confirmed, the option's almost always surgery to remove the tumor or tumors, although there are also cases that need to be treated with medication or radiation therapy. When the tumor or tumors have already affected structures like teeth, jaw, maxilla, tongue, lips, or cheeks, we have to plan to reconstruct these affected areas. This will help the patient be able to eat, smile, and speak again, and they might need speech and psychological therapies to reintegrate into family, social, and work life. Our dear patient saved her life with a routine appointment because we thoroughly examined her oral tissues. If you have any of these signs or symptoms, first of all, don't alarm yourself, but don't fail to go to your dentist and mention it. On the other hand, in your semi-annual checkups, ask your dentist to examine all your oral tissues, and you, at home, should also try to do it. That way you can detect and prevent a very aggressive disease. Share this information as much as you can, because you could be saving a life. Subscribe to the channel if you like these videos, and give this video a like if you liked it or learned something new. And I'll see you in the next video. I hope you're doing very, very well.